Sorry. All right, we will start off today, and Mildred, we'll have you open us up with a word of prayer.
Okay, let's pray. Loving Lord, we ask that you would give us today open hearts and listening minds, that we would be attentive to what you have for us to learn today. We're thankful for the opportunity to get out in the nice spring weather and look forward to gardens and lawns coming back to life. We're grateful for all that means in terms of new life within ourselves as well. Thank you for your blessings today, and we ask your blessing on this meeting in particular. Amen.
Amen.
All right, just want to welcome everybody to the community meeting for the Amarillo Branch NAACP. Again, we have moved to the Zoom format so that we could have a greater reach, and people can always refer back to the meetings later on and get some of the good information. The past couple months, we have enjoyed some really good panel discussions, and today I am extremely excited for us to welcome Marshall Dawkins, who is opening up a medical facility in the Hamlet Shopping Center. And to my knowledge, it will be the first medical facility in this area since the closing of the old BSA hospital on Polk and the Boulevard. And so, Marshall, how are you today?
I'm doing very well, Melody. Thank you for having me.
Yes, thank you. Thank you for being here. Thank you for your service. Thank you for the impact that you're about to have on our community. It's truly an exciting time.
I think so. Would you like for me to give a little background on me?
Yes, definitely. Let's start out there. You tell us about you.
Well, again, I'm Marshall Dawkins, fourth generation Amarilloan. I've been several things, but back after the turn of the century, I went back to nursing school, became a registered nurse, and a few years later got my master's and became a family nurse practitioner, and had worked several places, including emergency rooms and things like that. And it just, I had it put on my heart that it was time for me to open a clinic. And, like any good Christian, I sat in fear on that for about 6-7 months, and then got the prompting again, and was just drawn to North Heights. Know that it's a medically underserved part of Amarillo, and I've actually driven. It's 10 miles from my clinic to the hospital. So I'm very excited to be here. I have received a lot of great positive feedback. It's entitled North Heights Medical Clinic, and it will be a family medicine and kind of urgent care. If somebody cuts themselves and needs sutures, I can do that. I see everybody from 1 year old and up. I do not do newborns.
Okay. Okay. And so you said fourth generation Amarillo. So what, and you talked a little bit about this, but what exactly made you choose that location? I mean, most people would say, it's not needed over there. You're not going to get the business you can do over there if you were to go to maybe the south side or the east side. What made you choose that location?
Again, I started looking around and was out on Grand Street, way down at Northeast 24th and Grand, and just kind of started heading west, and saw some buildings that would require a whole lot of work. And I remember when I pulled into Hamlet Shopping Center, I've got very fond memories of Wonderland, and back when Twinks gun supply was here in Hamlet. And it's just so I found the spot, and I talked to a few people that I have a lot of trust in, and it all just came together.
Well, that is definitely amazing. And what do you think the impact is going to have on the Hamlet and North Heights community having a medical facility so close?
I think the impact is going to be quite positive. I mean, I look around and within spitting distance, I have 4 schools. So I'll be doing school physicals. This summer, I'm not equipped yet to do vaccinations, but this summer I plan to get all that together. So at the beginning of the school year, I also do Department of Transportation physicals for truck drivers. And that's another benefit of being over here. They can park, this parking lot is about the largest parking lot I've ever seen. So they can just pull their trucks in and I can get them a physical done and send them on down the road. And the real impact is, you wake up, you're sick, something happens, you don't have to drive miles and miles and miles. I'm right here in the neighborhood, close by.
Definitely. And can you talk to us a little bit about what are your pricing structure looks like if I don't have insurance, if I have insurance, what does that look like?
Right now, I take a limited amount of insurance, Aetna, Medicare. We're still trying to get on with Medicaid, which I know will be a big benefit here. Aetna, Cigna, United. Later this month, I will have a site visit with BSA Provider Network. And when I get approved by them, I will have access to like 30 insurance, which covers every insurance around this part of the world. The other thing, somebody comes to me, they don't have insurance. I drive around, I look at billboards. I've established a $40 visit for people that don't have insurance. And that's about a third to half less than other clinics. And the reason I chose that is, I don't want to take food off somebody's table, but this is going to be a for-profit clinic. I don't have any financial backing. I don't have BSA behind me or anything like that. So I think $40 is reasonable for a visit for somebody that doesn't have insurance.
Definitely. And what do you think is the timeline on being able to accept Medicaid? Is that like a year away? Is that way down the line?
No, we are actually the structure here is I've hired a billing company that works hand in glove with my electronic medical records. It's going to be all electronic charting. My billing company is the one that does the credentialing, and we are literally waiting on a phone call from Medicaid, and that's all we're waiting on, and that we cannot get them to call us back. So I would hope, I've let the credentialing department at my billing company know I'm opening Wednesday. I can't give you an exact time on that, but I would certainly hope in the next few days to a couple of weeks. And once I do get on with Medicaid, I certainly will make that announcement.
Okay, definitely. And is there anything that would be too severe for your clinic to handle? Like like you said, cuts and common colds and things like that. But if someone is feeling like, heart palpitations or things like that, is there anything that's too severe that they should maybe just go directly to the hospital or call 911?
Well, obviously things like heart attacks, strokes. At some point, I will have an EKG machine. But obviously, if somebody's something sudden onset, heart palpitations or left arm is hurting or the jaw, the classic signs of a heart attack or stroke, yeah, definitely go straight to the hospital. And if they come here and I do an evaluation, I have no problem. I know my limits, so I have no problem sending somebody on either in their own car or calling 911.
Okay. And so, Marshall, could you walk us through when we come into the clinic? Like, do you have the receptionist area and we'll fill out documents and set appointments and things like that? Do you do walk-ins? Which one do you prefer?
Uh, I'm taking everything. I don't have really a preference at this point. You can actually go to my website, which is northheightsmedical.com, and book an appointment. You can call. I'm in the process of getting all of our paperwork, our patient paperwork, put onto the website so that somebody at home can print it off, fill it out, or they can come in here, sit down and fill it out. We also will have a patient portal so people can go online through the patient portal and be able to check lab results and things like that. We do have the ability to draw labs here. I'm in partnership with LabCorp, and they give me the labs. I will have a fee schedule on those, and it will be much less expensive to have me do the labs and charge you for it versus you going to LabCorp. And because that's the way LabCorp prefers it. They would prefer, we draw the labs here and send it on. So yes, ma'am, you sign in. I have maximum capability is I have 5 exam rooms, but I've only outfitted 3 of them. I can see a lot of patients with just 3 rooms. So I'm not expecting, long waits for, to get into a room and be seen. And I guess if we're real busy and we have a walk-in, people that have gone to the trouble making an appointment would have precedence over somebody walking in. But, I hope and pray that I'm really real busy, kind of quickly. But that's God's will. So.
Definitely, definitely. And people who may not have a driver's license or identification, what types of identifying documents are going to be needed in order for them to be seen? I know they'll have to do the application, but oftentimes doctors are asking for driver's license or ID. Are you requiring any kind of ID?
Unfortunately, that's kind of beyond my control. Yes. We need to verify that, Joe Smith is Joe Smith, because, we are establishing medical care, and there's a lot of HIPAA involved in that. And so, but I would think, that's a really good question, Melody, that let me get back to you on that. I'm going to make a note of that.
Okay.
Because I don't know if a water bill, or an electric bill or something like that would work. So,
Okay.
but I do know that I need to be able to verify that, Joe Smith is Joe Smith.
Okay. Okay, and we have an increasing population of non-English speakers, whether that be Spanish speakers or whether that be part of our refugee population. Are you going to have ways to communicate with these different populations, or do you encourage them to bring someone with them that speaks English?
I would encourage they bring someone that can translate. However, through Brady Clark and Square Mile Ministries, I will be able to have translation services available. Yo hablo español poquito.
Yes, me too. Very little Spanish. Well, that is really good. And just overall, how important is healthcare? How important is that to our society, to the people in our society? Just having healthcare, how important do you believe that is?
Well, I'm in the field of medicine, so I believe it's very important. But look at it from a global standpoint or the 30,000-foot view. People may feel good, but our bodies can start doing some pretty funky stuff. And Tracy Matthews, who had Tracy's Bubbles Detail Shop, was my neighbor for many, many, many years. And he succumbed to prostate cancer because he wouldn't go to the doctor. He started having troubles and just put it off. And men are more susceptible to that type of behavior of, oh, it hurts, But the other thing is important is somebody that already has a disease state such as diabetes or congestive heart failure. It's paramount that they have somebody overseeing the care and the management of that. Especially diabetes. Diabetes is pretty rampant, but it's a disease state that if you take care of it, if you manage it, you can live a full life. And have a great time, So it's not only the yearly annual come in, get some labs drawn, make sure everything's okay. It's also, if you're not feeling good, we maybe draw some labs and turns out, you're anemic or you have some thyroid problems, and we get those taken care of and adjusted, and all of a sudden you're back to feeling better,
Right. Okay. And you can do things like referrals, like if someone does come in and they do find out that they have cancer, like you would then refer them to an oncologist and
Absolutely. Yeah. It's I'm no different than any other medical clinic. And through BSA, when I get on board with them, I'll actually be able to admit directly to the hospital. So
that's fantastic. And when you talk about prescriptions, are you going to have any partnerships? I know that like Walmart has the $4 prescription, that you can get $4 prescriptions there. Are you going to have any other access to prescription drug plans that may bring down the cost of medication?
I won't, but like you say, there is Walmart, CVS, even the pharmaceutical companies help out, have really embraced that and trying to make medicines more affordable. I obviously will have the ability to write prescriptions. And let me go and make a note on that. I'm very, very limited in any kind of pain control. And that's not just a choice by me. That's the Texas Board of Nursing that has limited nurse practitioners to being able to only write Schedule II narcotics like hydrocodone, fentanyl, things like that. They've limited nurse practitioners to be able to write those drugs in a hospital setting only. I will be limited to, tramadol, Cherotessin, and I need to double check on maybe Tylenol with codeine. So, and we won't have any of those type of drugs here in the clinic.
Okay. And as far as payment, will you be taking cash and check and credit card, or are you not going to do checks? How will payment be taken care of?
Well, we will accept cash, check, or credit card, debit card, and payment is due at the time of services, whether that be, the $40 visit for no insurance or a copay.
Okay. And the labs that you're going to be doing, will they have to pay for those labs at the time of service, or will they be billed for those?
No, they'll need to pay for those at the time of service as well. Unfortunately, there's been a history of people not paying if you try to bill them, and I don't have any way to go collect that. So
Okay, so definitely. And are you partnering like with the health department or other health entities in Amarillo, maybe to provide diabetes classes? Or I know the health department can provide vaccines maybe in the interim until you're able to, things like that. Are you looking into partnerships like that?
I am. I have not started that process. I really want to get the clinic open, get my feet on the ground, be open for a little while before, make sure I'm going to be established and stay established before I go looking at partnerships like that.
Definitely, definitely. So at this point, I'd like to open it up to anyone else on the call that may have questions, comments, concerns, anything that you'd like to speak with Marshall about.
Yeah, I have a question. There's quite a bit of documentation of both historical and current mistrust of medical providers by by people of color. And I'm wondering how you feel you can address that.
That is a good question. And the way I feel I can address it is to show up, be here, treat people with respect, kindness, love. Nursing is a very compassionate profession. So I do understand that there may be a little bit of mistrust in the beginning. And the only thing I can do is do what I do, and that's show up, treat people the best I can, and go from there, and hopefully get the good word out.
The thing that I have heard most frequently, I mean, besides mistrust arising from things like the Tuskegee experiments, but in terms of a more current concern, what I've heard most frequently is discounting of pain expressed by people of color. And I'm wondering if that's something you paid attention to, if that's something that you've been able to address within your own self, to be aware of that tendency and to not do that.
Absolutely. After years of being an emergency room level 1 trauma nurse down in Lubbock, pain is subjective. Somebody who rates their pain an 8, another person might rate it a 2. In terms of acknowledging and respecting the pain level they are telling me, absolutely, I will respect that. However, like I was telling Melody, I am somewhat limited in what I can do to get that pain under control. If somebody comes in here asking for Demerol or hydrocodone, I don't want to lose my license. I simply cannot write those level of drugs. So at that point, I would refer them to a pain clinic, or to maybe perhaps a medical doctor that can write those medications. But as far as discounting somebody's pain, no, I was trained early on. You don't do that.
Are there other questions from members of the NAACP?
That one. One of the really a crisis at this point in our area and region that the health department's identified and state and national level have identified in Amarillo is we have a very large number of STDs for our population. A lot of spread, some of them very serious, untreated STDs. Is that something that you might be able to help with this new clinic, being able to reach out to people, making sure that they know to get tested? Are you able to do those tests, send them on over to the labs, but maybe do the draw or suggest tests to people based on symptoms, things like that? Is that something you could there's a huge need for that. So is that something you would be focusing on?
Absolutely. I mean, if a patient has concern about an STD, we'll be able to test them, by drawing the labs and sending them out. And certainly if they come back with an STD, if there are available treatments, certainly I'd be able to follow those protocols. Some of them, like herpes, they have a treatment, but no cure. And of course, other STDs have cures. So But to your point, yes, I'm very aware of STDs and untreated, for sure.
All right, thank you.
You're welcome.
And how do you feel about what's going on right now with COVID and access to vax, anti-vax? Could you speak a little bit to the pandemic and what is continuing, and how do you feel about like the treatments and things like that?
Well, I don't know if you all are going to agree with me, but I want to be honest. The pandemic and how we handled it, I think, was an atrocity. And if somebody wants the COVID vaccine, I will not deny them that. But in my opinion, and in what I've read, it's not really a true vaccine like polio or smallpox vaccine is. So somebody comes in with COVID, I certainly can treat them with Paxlovid and things like that. Actually, that reminds me, I need to order some of that stuff. The good news is we're coming into summer, so we should see those numbers start to kind of come down some. But and people, elderly people, I recommend getting the vaccine. I just have known several people that got the vaccine and have developed health conditions. My mother being one of them, got the booster and developed AFib. She'd never had any cardiac issues before. So.
And okay, does anybody else have any other questions or comments or?
Following up a little bit on the vaccine things, one of the more recent stories we've been following is that, again, nationwide, but also in this area specifically, we've had a significant increase in the number of measles cases, and historically low measles vaccination rates. How do you feel about that? Any thoughts on that?
What do you mean by needle incidents?
Measles.
Oh, measles. Absolutely. I mean, yeah. I mean, we have a vaccine for it, and it works. It's been established for decades, and I certainly by no means am anti-vax. I firmly believe in measles, smallpox, polio, and all the other vaccinations we have. I'm just not a huge fan of COVID vaccine. But yes, those vaccines are tried and true, and they're proven, and we have long-term data on their safety. And the fact that somebody would not get them, I would always strongly encourage them to get vaccinated.
I don't believe we've heard your hours.
Right now, and the only thing in concrete is the walls and the floors. So there's lots of variability, but right now they're set Monday through Friday, 8 to 12 and 1 to 5. We'll take an hour lunch. And like I say, that if we don't have a lot of patients on a Friday afternoon, we may adopt changing those hours to maybe closing at 1 o'clock or something like that on Friday. But right now, basically 8 to noon and 1 to 5 Monday through Friday.
And appointments can be made at northheightsmedical.com. Is there a phone number that can be called to make appointments as well?
Yes, ma'am. It's area code 806-910-9969. And of course, all that information is on the website as well.
All right. Well, I think that it is amazing that you are undertaking this type of venture in the location that you're going to be in. And I just want you to know that the NAACP is always available if you need anything. We'd love for you to become a member of the branch. We have these meetings on the second Saturday after the second Thursday of every month. And if there's anything that we can ever do to help in any way possible, we are definitely available for that. Including helping you get any kind of connections to resources and things like that. Dr. Shanna James is a member of the branch, and she is, usually she's here, but she has an event today, but she's with the health department, and they do quite a bit with immunizations and things like that. And
Fantastic.
if we, in helping you just get the word out about the clinic, I think that we could definitely share information on our pages and things like that. But again, we just want to thank you for taking a chance and opening the clinic, and we wish you all the best.
Thank you very much. I'm excited about it, and just look forward to getting going and being able to help out as much as I can up here.
Definitely. And once again, when do you open again?
We're shooting for Wednesday, the 17th, this Wednesday.
Okay. So Wednesday, the 17th, you guys will open at 8 a.m. Your hours are going to be 8 to 12 and 1 to 5, Monday through Friday, and then possibly changing on Fridays, depending on how busy you guys are a little bit down the line.
Yes, ma'am.
Okay. All right. Are there any other questions from the members of the NAACP?
Just thanks for coming to speak to us today.
Well, you're welcome, and thank you for having me, Melody. It seemed like it worked out perfectly.
Yes, it did. It did. And thank you for being able to pivot on such short notice. So that's amazing. Thank you for that.
Well, believe me, opening my own clinic, I have learned to be flexible.
Definitely, definitely.
Well,
Well, go ahead.
I was going to say I look forward to meeting all of you in person at some point down the road. Feel free to stop by the clinic and look around. We will be in Monday and Tuesday doing some training, and then Wednesday we quote go live. And what that'll be is we'll be online with the eClinical Works, and they will be shepherding us through, making sure we're dotting all of our I's and crossing all of our T's.
All right. Well, fantastic. Again, thank you for taking time out today to be here with us. Good luck with the clinic, and we hope that we can work with you and see you very, very soon.
Fantastic. I look forward to it. And I will email both of you all the updated flyer.
Okay, perfect. And we'll get that posted along with this conversation, and we'll make sure that we're sharing it so that we can make sure that people are aware of the clinic and that they are utilizing those services that are so important to the health of our community.
Fantastic.
All right, thank you so much. And on behalf of the Amarillo Branch NAACP, we want to thank everybody for tuning in today. If you have any further questions or comments, you can definitely comment here below on this recording, or you can reach out to us directly. Hope you guys have a great day, great week. Get outside and enjoy some of that sunshine today.
Okay, take care.
Thank you.